All right, good deal. Anybody got any questions for Commissioner Berry, myself, or Dr. Toomey this morning?
Yeah, Governor, do you have some specific numbers about how many doses have been administered, and then specific timing on when patients in nursing homes will start to get the shot into the arm, not just staff here?
I may let Frank or Dr. Toomey answer that. They probably have better information than I do.
Sure. I just wrote this out this morning. Our allocations of Moderna are 234,000. Our allocations of Pfizer are 268,125. I was told we just got a shipment in this morning, and those will be going to providers all over the state. And we anticipate, that there's 39,000 doses of the Pfizer that will have been deployed to long-term care facilities through this partnership. And so if you think about it, the providers here at the long-term care facility are the firewall protecting the residents. And so they will be vaccinated first. And then after the staff are vaccinated, then the workers or the residents will be vaccinated. So that's it's a very strategic way to work. If you're actually protecting the residents by vaccinating the staff and doing that very, very quickly. And I think I answered your question.
Do you know how many of the allocation have been administered so far?
Okay, there's a website. I don't know if you've seen it. It's on our website. It's usually about a day behind because there's been vaccinations over the weekend, but it's still saying 26,000, and I know we've done more than that. And so because that's what's entered into the GRITS, the immunization registry. And so if you look later today, it'll be updated with the most recent updates. And just know that there's a bit of a lag between the actual administration of the vaccine and then the reporting into GRITS. But the website is a good way to keep track of that every day.
And let me just add one thing, Dr. Toomey. On the numbers, I think just like today, starting in nursing homes, this is going to ramp up. It'll, always the first few days it takes a while to get everything going. But really, for the last 2 weeks, the vaccine's been given out. I talked to, I think it was 11 hospital CEOs all across the state when I was driving home. I guess it was 2 days before Christmas. And you could literally tell the excitement in their voices because they were all given the vaccine. They had all gotten it. Some, it took a little longer than others, but they all had places set up in their facilities. They had people rolling through there. When we were with John Lewin at Emory the other day, he said they have the ability eventually to do 4,000 vaccinations a day if they can get them. So I can promise you, CVS, Walgreens, the nursing homes in our state, they are ready. We just got to get the ball rolling, which it is starting today. But in our hospitals, I think that's going very smoothly from what I've been hearing. Yeah.
This is going to be for all of you. I was hoping you might be able to speak to just a logistical challenge, obviously, of getting these vaccines to care homes that literally are in every town across the state. And then secondarily, the 95% number who are enrolled, does that 95% number also include very small personal care homes that maybe aren't under DCH authority, but are under 25 beds?
I may let Frank or Dr. Toomey speak to the last point. I would say logistically, again, thank you to the Trump administration, Operation Warp Speed, the public-private partnership with CVS and Walgreens just to go straight to the facilities like here at Pruitt and take the states out of being the middleman. Obviously, the doses are coming out of our allotment, but to me, that makes a lot of sense that they're working on the logistics of that. So I feel like that's going to go very well because you're going to a specific location. They know how many staff, how many residents, so you know how many vaccines to ship. You can be very efficient in the way of doing that. The challenge, I think, for us, and I'm just speaking for myself, I'll let Dr. Toomey or Frank weigh in on this if they would like, but when we get to the general public, that's when you have even more of a logistical challenge, which is but there's good things that are happening, and we're continuing to work on that every day. Like Dr. Toomey said, we have 900 providers that have now signed up. We've got our local pharmacists, we've got our public health departments all over the state, every county in the state. So we're going to gear that up and get this vaccine out to people, whatever it takes. We will deploy whatever resource that we need to. And then y'all feel free
Sure,
to.
I can say a few words, and then Commissioner Berry. The benefit of this partnership with Operation Warp Speed is that they actually ship directly, although we have some vaccine shipped to our warehouse so we can keep it for emergency purposes when there's a need at a hospital that finds that may need additional doses or other providers. We're trying to reach all those providers who aren't reached by hospitals through our public health departments. And I mentioned that we've vaccinated hundreds of such providers, including primary care physicians, dentists, and others in the community. And as the governor said, I just wanted to comment again, it's just amazing to see people's faces and the excitement, the tears of joy, literally, in the waiting room of providers who have been working at this for so many months, and now seeing that there's an end in sight, a ray of hope that is going to protect them and their families, because they've had to worry about that. So the logistics are difficult because of the cold storage issue, and so you have to match the provider with the right vaccine. But once we direct where they go, it's shipped kind of automatically through the process, and it's working very well and be shipped directly to these long-term care facilities. We anticipate that the personal care homes will be vaccinated by our public health departments, and they will be working directly with our public health, county and district health directors, and so we'll be continuing to roll that out, and that's part of their work in the community.
No, that covered it. Thank you.
Everybody that's freezing to death in the back, please feel free to move to the sunshine if you won't bother us at all.
Governor, one last question. Obviously, today is a very exciting day, right? It's a great day. But we've also heard from folks that once you get the vaccine, you still should be wearing your mask. Can you just, again, speak to the fact that even though today is a great day, it's not a day to let up on what we've been doing for so many months?
Oh, no, absolutely. We've got to continue to use best practices. Obviously, this is a dual dose vaccine. So I'll let Dr. Toomey speak to more of the specifics of that, but we cannot let our guard down. We've got to continue to do those 4 things, or 5 now, with wearing your mask, practice social distancing, wash your hands, follow the guidance, and get the vaccine when it becomes ready. That's what I'm going to do when I become eligible as well. And Dr. Toomey, did you want to add anything?
Now, it's very important that remember that until everybody, as many people as possibly can be vaccinated, and so we're hoping at least 70 or 80% are vaccinated, we won't have the kind of immunity in the community that we will need to ensure protection. Between now and that time, we should all follow those same guidelines and continue to social distance and wear a mask, and follow wash your hands, follow the public health guidance. So even as we're doing this very aggressive campaign, we've got to continue to remember to do that. And as we learn more about the vaccine and how it prevents disease, we've got to continue to do that, because there may be still more things to learn about whether it prevents asymptomatic cases. What it prevented were symptomatic cases and serious cases and hospitalizations, so the worst possible complications of COVID. And we're still learning more about that. But it's just, I think, very important to remember, particularly now with the holidays and New Year's here, that we don't want to see another spike after the holidays, and so continue to follow those guidelines. One more thing about logistics. One of the other important things to bear in mind is that this is a 2-dose, not a 1-dose vaccine. Coming down the pike will be some one-dose vaccines, perhaps as early as the spring, if not earlier, and that will make it probably significantly easier logistically to vaccinate, and particularly in areas without the kind of tracking mechanisms that we have. And so that we are monitoring to ensure that we know exactly who gets which vaccine, because you can't mix the vaccines, and then call them back exactly either 3 or 4 weeks later, more or less, to ensure that they get vaccinated again. So this is all part of that logistical challenge that we talked about, but we have it automated in a way that we can order that vaccine and have them come in and automatically distributed to those providers at the right time.
Thanks, everyone.
Are we going to hear by any chance from one of the providers getting the vaccine?
That, I'll refer to the facility on that.
Let me just again thank the team from Pruitt for having us today, and Jonathan, thank you and your colleagues for your willingness to step up and get vaccinated. I think this continues to just help build the public confidence out there, and thanks again for that, and thank you all for being here. Thank you.